I am called Debo Ronald. I'm the Executive Director for Healing Hands Foundation. Healing Hands Foundation has partnered with Emoter to offer this medical camp. Healing Hands Foundation, we do a lot of things. We do skills development. We do clinical and community health. We do sustainable environmental management. We also do water and sanitation. Those are the thematic areas for Healing Hands Foundation. So we have partnered with Emoter. Emoter does similar things. Our objectives are together. So this time we are focusing on the clinical and community health. We're organizing a 3 days medical camp. It started today, 12th, 13th, and 15th of this month. We shall be having a medical camp here. We're seeing all sorts of conditions, and the treatment is free. Laboratory services, the treatment, immunization, all those services are done free of charge. We are partnered with the Rema Medical Group and the Uli Health Center and the Central Division, Arua City. Yep.
What is the target for the 3 days, and for those whose services may not be available, are there referral cases?
Yeah. So you will see there are about 18 doctors here. 12 from USA and Europe, total 18. These are general practitioners. So our target, I told them to see at least 1,000 people per day. But I think from the way I'm seeing, they will be seeing about 700 to 1,000 per day. So if they can see up to 2,400 people in these 3 days, I think the target has been achieved. So the age group is from age of 0 to the highest, and all conditions: pregnant women, chronic diseases, malaria, HIV, all sorts of diseases we're managing. The barrier to accessing health are enormous. Finances, knowledge, access to health workers, access to equipment and technology, and many of them. If you see in Arua City here, first of all, as you know, Arua City is heavily populated. Our population is around 480,000 people in the city here. And with the meager resources of government, the only government facilities here are Uli, Arua Regional Referral Hospital, and the police health center too. So the services of government in those areas are not adequate. They are overwhelmed with a high number of people, with the prevailing poverty. So many people are sick, but they're not accessing services. So our intention is to come and fill that gap. People are sick, but they're not getting services, and they don't have money. This is an opportunity for them to come and get the care.
Is it going to be sustained, or this is going to be a one-off?
We intend to do this thing after every 3 months. That is our target. Because you can see the numbers here. The demand is enormous. It can't be finished in one camp. So my discussion with Emoter is that after every 3 months, if it is possible, we need to organize camps here in Arua City.
What is the area coverage in terms of, there are people who may not be in Arua Central Division, but will want to access this medical camp?
Correct. Health has no borders. From Congo to South Sudan, to all the districts around, they are free to come. You cannot segregate somebody because of his location or his affiliation religiously, politically. No. Everybody who needs the services must come.
In terms of maybe the medicines available, do you think there will be cases of referrals, or all these cases can be managed there?
Definitely. Why we have decided to do it in Uli is because there's going to be referral, there's going to be follow-up. So we're working closer with the people of Uli Health Center here. The conditions which they can manage here, they will be coming back for that. The ones who need referral within Arua City will be referred appropriately. The ones that need referral outside of Arua will also be referred appropriately.
What are the common diseases that have been, registered?
So far, malaria is leading, as expected. Upper respiratory tract infections, urinary tract infections. Then there are some few cases of hypertension, diabetes, autoimmune diseases, some skin diseases. I've seen a case of cancer somewhere there. There are even ENT issues. There are a range of conditions, but for sure malaria, upper respiratory tract infection, UTI have come out prominently.
Arua being a referral facility, do you think there's need to have a general hospital for Arua city?
Definitely.
I mean the central division.
My observation, Oli should be upgraded thoroughly because the demand is too much. In terms of infrastructure, human resource, equipment, and I think even the procurement of drugs and supplies as well. Arua Regional Referral Hospital should be at the level or close to Mulago. You know, we are 540 kilometers away from Kampala. It will be in order to equip the referral hospital with all the latest technologies and all the required services and human resource so they can be a prominent referral center here. And for the sake of Oli should do most of the work. The common medical examinations, some basic surgeries, maternal health should also be covered here adequately. So that people who are going to referral should really go for high-end services. Like you're going for CT scan, MRI, radionuclide imaging, you're going for intensive care unit, dialysis, heart surgeries. Now that's the level where hospitals should be. Absolutely free of charge. The contribution here, we got a little money from Healing Hands and Emoter put together to procure these drugs, supplies and the laboratory agents. Yes. But European Union took care of the experts. These doctors came all the way. Their visa, accommodation and transport is handled by the European Union.
So my name is Hélène, I'm from France. I'm a European volunteer for Emoter. I've been volunteering for 5 months with them as a health teacher, health education specialist. We are today in Arua for medical outreach, so we have several activities related to it. So we have vaccinations, especially for the main vaccination that we're doing is HPV for girls that are between 9 and 14 years old. We also do immunization for children, and we have also a test station where we do a lot of malaria tests. This is our main action is malaria tests. Also some HIV tests, and this is new, but today we are also doing pregnancy tests and glucose tests.
So what about cases where there are complications? Is there a referral pathway so that they can get better services?
Yes, we are. So the goal of the medical outreaches is to go to places where to reach people who cannot access regular health services, health centers, hospitals, etc. We are giving free medicine for them. We are conducting those medical outreaches in 3 districts. So Nebi was the first one. We are doing that since 2020, okay, in Nebi district. And since 2023, we're also doing it in Arua district and Pakwach district. So basically, our medical outreaches, we do it once every 2 months, so every second month. And we dedicate 1 week to each district. So 3 weeks in total, one for Arua, one for Pakwach and one for Nebi.
So every day, what is the target? How many persons are you able to see?
The target is, the formal target is 500 persons. Sometimes we reach a little bit more, depending on also the availability of medicine and tests. But the target is 500, yes.
Based on your observation, what are the common diseases?
The common diseases, the most common here, I would say, is malaria. And for malaria, it's very important to react quickly. The prophylaxis is very, very efficient, but we have to. It's very important to test people if they have the symptoms. So I don't know about the proportion of people who get tested and are positive to malaria, but it's quite a lot, especially in rural areas. Here we are in Arua town, but in rural areas it's even more. Yes, we have also a lot of urinary tract infections and things related to sexual transmitted diseases. Yes, that's also why. So I'm a health education teacher. We are also doing workshops for children, and we raise awareness on STDs. We introduce family planning methods, and yes, to have. This is in the background. It's not related to medical outreaches, but sometimes we do it at the same time. Yes.
Maybe when it comes to referrals, do you have any referral supports to the people who are referred?
So it happens also. We have some immune disease, for example. We try to fundraise. We cannot fundraise for them, so we make videos for them. We advertise and we try to raise money for them. So we are able to have a long-term following, a long-term checkups on those persons. We are trying to develop it. So for now, it's only a few persons, of course. But we are also, of course, collaborating with the health centers and medical system of the regions where we are working. For example, of course, we do HIV tests, so if someone is positive, we apply the protocol. And there are things for which we are not competent. When it's too serious, for example, we are the first care help. So if something is more serious and require some more serious following, we orient those people to the health centers or to the hospitals. Yes.
I'm calling Emoter Fatuma from Jacinto Cell, Kenya Ward. I just thank to Chairman of Chamber of Commerce to organizing for us medical camp.
What was the challenge that brought you here, or the sickness that made you come here?
I am sick. The challenge which brought me here, if you go to Arua hospital or dispensary or leave, at times they are not attending you. You just wasting your time there. You not getting medicine. What? That's why we came here.
So were you able to get the medical services you wanted?
Yeah, I got.
So what is your appeal to other people who have not been here? People who have not come here, maybe they are still at home.
We are going to mobilize them to come to the medical camp to get medicines.
My name is Arua. I came from Kenya Ward. That's where I live from.
Yeah, tell us about this medical camp. How is it helping people here?
It's good, It's good, but the thing is that people are few. We need very many people to come and attend this thing. That's why they are doing checkups here.
What are the common challenges that are bringing people here for this medical camp? Common diseases in your area?
Malaria, typhoid. Then it's only malaria and typhoid. Ulcer. This ulcer is there, and there are very many things, by the way.
There are people who don't want to come and check. What is your advice to them?
They should come and check, so that we should know what they are suffering from. If you don't come for it, I don't know what to do now.
What about people who come here, they are not able to get the service they want? What can be done to them?
The good things that they already know what's there now. You already know that I'm having malaria, I'm having a typhoid. If you don't get the medicine there, it's good that you already knew what's in your body. You go and buy. There are very many pharmacies where you can get. If you have money, you go, you buy medicines from there. We are having medicines there, but they are few.
What about referral cases? Are they referring people to the hospitals?
If it's emergency case, they will refer.
By name I'm Oshuga Rashul, the Speaker of Central Division. In the first place, I am so grateful to Healing Hands and Emoter for partnering to make sure that they improve our healthcare system in the Central Division. Not only in the Central Division, but the entire city at large. Looking at this health camp here, I think it will improve on or add on what really the government is doing. If you look at our health facilities that we have here in the Central Division, basically we only have 2 health facilities. That is the health center 3 at the police, and then the health center for that we have in Oli. So these 2 facilities are not enough. Looking at the current population that we have in the city, which is about 380 plus, you find that these 2 facilities are not enough. We have the Arua Regional Referral Hospital, which cuts for the entire region. So basically the 2 facilities are not enough. The Oli and Arua Hill population, if you look at the great Oli population, it is really too much. So the health center for here is not enough to cater for the population.
So is there a need to elevate Oli to a general hospital?
Obvious, there is a move. Not only elevating it to a general hospital, there is also a move that we took as council to ensure that the former Arua Hill Division headquarters is given as a health facility. So I think this will add on to the number of facilities that we have here in the Central Division. So there is that move to elevate the Oli Health Center and also have a former Arua Hill headquarters as a health facility.
How do you intend to ensure this support from maybe organizations continues? It's not just a one-off thing as council.
Looking at the turn-up and the mobilization, one thing I have noticed is it's not enough, and having only 1 health camp here at the Oli Health Center is also not enough. To me, there's a feeling and there's need for us to have these camps in these wards, all the 6 wards. We have 6 wards in the Central Division. If we will remove ward to ward, I think the last person in the village there will access this facility here. I've looked at people coming here. There are only a few people who come from the former Royal Division. Most of these are people within Oli Division. So if there was also another camp organized like in the former Royal Division, people living in Vara, Awendere and Baza will also get access to such facilities. So to me there's need to have more of these health camps. If possible, move ward to ward so that every person gets the touch of this facility.
As council, what budget do you have for health services in your division? Is it enough?
To me, the health budget is not enough, but we always ensure that every budget much is catered for health facilities, things like garbage management and so on. We make sure that there is proper budget. Although with the level of turnover of garbage and so on, sometimes you find what we budget we think is enough, but at the end of the day we realize that it's not enough. But we always ensure that health is a priority.